Okay, thank you, Miraji. Thank you, Shailesh. Swagatam. You are all welcome to Saspandan TCM Academy. Namaskar. Our today's topic, how sadness and the grief effect. So that impact physical and the mental health. So it is a psychosomatic topic. So this is the character of the lung. Friends, all of you know our diseases are psychosomatic. More than 90% diseases are psychosomatic. So our mind created thoughts, our mind created emotions, our mind created images that cause disease. So lung emotion is the sadness and the grief. Okay, we are starting from the lung. So one by one sessions, we are covering the all element. We are covering the all element. Now today we are talking about the lung, after that kidney, after that liver, after that spleen, after that heart. Okay, so today's subject is the lung subject. So lung emotion is the sadness and grief. So how sadness and grief affect that impact on our physical and mental health. Okay, so this is the pre-session. So in this sessions, we are discussing the sadness and the grief. That is the etiology, how it start, how it originate. It is the chronology, how it's developed, how it's travel, its pathology, and their TCM disease patterns, and how to treat, how to manage with the acupuncture points protocol. So, understanding sadness and grief. What is the sadness and what is the grief? Sadness and grief affect both our emotions and our physical body. Our emotion state has the direct connection with how, why this coming. So our emotion state has the direct connection with how our body function. Friends, when we feel sad or experience grief, it can influence the heart and the lung. Okay, it can influence the heart and the lung. And our overall well-being. Sadness include feeling of regret and act. Okay, it is the dard, act, sadness. There are the act. Okay, and always related to past action or the decision. So how we take the past action and the past decision. Okay, so these emotions deeply affect the mental and the physical health, especially the heart and the lung. And this can cause to emotional imbalance and various health problems. Now, recognize and addressing sadness is the very important for the improving the emotional well-being and supporting healing. Understanding the nature of the sadness. How to understand the nature of the sadness? Regret and the act is important. Sadness always include feeling of regret, which can make a person think repeatedly about a past action or the decision. Okay, who which person is sad? So read his mind. He is he's repeating. Okay, he's thinking about his past actions and past emotion and past mistake. This emotional state can create a cycle of the negative thinking, which cause to more distress and complex emotional pain. Sadness is a complex emotion, so it can also up in many ways, such as the emotional pain, a sense of loss, and the difficulty in feeling joy in daily life. This feeling can strongly affect the mental health. So, how to focus on so okay, so that that person focus on negativity. How sadness always make a person focus on the negative experience. This create emotional barrier and slows down personal growth. Okay, sad person cannot grow with the personality. Okay, so it's slow down the personal growth. Over time, it can also cause to feeling of the isolation and the hopelessness. Sadness, grief can impact on the clinically. Sadness and the grief deeply affect on the heart and the lung. So it deeply affect on the heart and the lungs. So leading to many physical symptoms. According to traditional texts, this emotion make the heart feel tight. Okay, when sadness is there, so heart will be feeling tight. It will be disturbed and agitated. This disturb the lung and block the smooth circulation of the chi. Okay, lung is responsible for the chi. It is the energy. Because all of blockage, a person may experience a weak pulse if you find his pulse on the lung position. So it will be weak. Low or weak voice if there is the lung chi deficiency. Okay, person voice will be low. He cannot talk loudly. You need to hear with concentrate. Okay, so you have to hear that person with fully concentrate because he's talking low. Its voice is low. Person will be tired, tiredness. That persons have the pale complexion, pale complexion, pale face, and slightly breathlessness and emotional discomfort. Now, what is the effect on the heart when there is the sadness and grief? Sadness creates agitation and the tightness in the heart. This emotional disturbance can cause physical and emotional symptoms. When the heart becomes agitated, it affects the lung by blocking the flow of chi and causing heat to build up in the body. Okay, so heat will be developed in the body. As a result, a person may face several health problems due to poor functioning of the both the heart and the lung. Now, what are the consequences of the lung when there is the sadness and the grief? When the heart is disturbed, the sadness also get affected. Sorry, when heart is disturbed, the lung also get affected. The blocked lung cannot circulate chi properly. And this causes to symptoms such as the weak voice, tiredness, and breathlessness. This shows the close connection between the emotions and the physical health. This condition, so weak heart and weak lung because of sadness and the grief. Okay, this shows the close connection between the emotions and the physical health. And long-term sadness can weaken the lung chi, which can further increase physical health problem. Now, what about the vital essence, that is the chi? What about the vital chi and the emotions? So let us see the importance of the chi. Chi is the very essential for the maintaining good health and the vitality. Chi flow throughout the body and support both physical and mental well-being. When chi is strong and balanced, a person enjoys good health. Okay, that you agree? When chi is strong and balanced, a person enjoys good health. Secondly, effect of sadness on the chi. How sadness effect on the chi. Sadness and the grief can reduce the level of the chi in the body. When chi become weak, it affects the overall health and create emotional imbalance. Depression and it affect on the health. Depression can cause many health problems, including chronic tiredness, emotional instability, and weak immune system, weak immunity. So, how chi stagnation? Stagnation of chi. When sadness and grief continue for a long time, chi becomes stagnant. This can cause to many health issues, showing how emotions and the physical health are deeply connected. So, when we are trying to see the pulse in the sadness and the grief, okay? So, pulse give clues about the emotional conditions. See, a weak pulse shows sadness and the lack of s- smooth energy flow. The front pulse position on the lung area. Okay, front pulse position are especially important. Pulse may show G deficiency when there is the lung pulse is weak. Okay, you can tell patient, you can identify patient. So it is the G deficiency. What are the physical sign of the sadness? Physical sign of the sadness. Sadness can cause several physical symptoms that affect the emotional struggle. That common signs include weak voice, chronic tiredness, pale complexion, light breathlessness, and the frequent crying. That patient always, so when he talk normally, he talk in the crying tone, always. See, you can interact with many people. They talk normally, but they talk crying. I can't have the confidence. Heavy or tight feeling in the chest. Okay, their chest will be heavy and they are suffering tightness in their chest. In woman, sadness may also cause issue like the amenorrhea, absent of the menstruation, amenorrhea due to depleted lung chi. Okay, when lung chi is depleted, there will be symptoms of the amenorrhea. No menstruation. So, long-term effect of the sadness and the grief. How sadness and the grief can affect on long term. Number one, chi stagnation. So long-term sadness and the grief can block the smooth flow of chi. This may cause chronic problems like fatigue, breathing difficulties, and emotional imbalance. Now, emotional disturbance. So, constant sadness may cause to anxiety, depression, and difficulty maintaining the relationship that affecting the social well-being. Okay, so that person cannot mix with the relation in a marriage party. So he's not dare to go there because of sadness. Number three, physical complication. So physical complications are when lung and the heart chi become weak, lung and heart energy become weak because of prolonged sadness. It can cause to menstrual period is not regular in women and the general decline in physical strength and the vitality. Heart and the lung, that is the primary effect of the sadness. Okay, primary effects, primary sadness, when there is the sadness and the grief is begin. So they attack on the heart and the lung. Okay, sadness mainly affect the heart and the lung. It can cause symptoms like the agitation and the poor circulation of the chi. Because because of this, heart become tight or wrinkled. Okay, it shrink, it wrinkle, and the lungs get obstructed. This may cause to weak pulse when heart become tight or the wrinkle and lung get obstructed. Then you can feel his front uh, position pulse will be weak. So there will be breathlessness and low energy like fatigue. Liver also involved in this case. Liver, it is the secondary impact of the sadness. First impact, lung and the heart, and secondary impact, the liver. Liver is the secondary impact of the sadness. Sadness can also affect the liver. It causes to mental confusion and emotional instability. Friends, when sadness weakens the liver, it may cause chi deficiency and the difficulty managing emotion because there will be chi stagnation. Okay, chi in this chi. Okay, so their organ property, liver organ property, chi ensure the free flow of energy and chi and the blood and the emotion. So chi unable to ensure the free flow of all these things. And this affect the mentally and person's sense of direction in the life. So how understanding the sadness and the grief for emotional health. Now, identifying and processing sadness and the grief is very important for the maintaining the emotional balance. These emotions can weaken the body and disturb different organs. That's why it is important to reflect on your feeling to support better mental and physical health. When we accept and understand the sadness, we develop better coping mechanism and improve overall well-being. So this was about the sadness. Okay. So this is the definition of the sadness. Now we are the TCM worker, we are the acupuncturist. Okay. So now discuss how TCM framed sadness and the grief. So primary organ involved in sadness, primary organ involved is the lung. Lung is the Po. Po means it is the corporeal soul. Corporeal soul disturbed. When sadness and grief is there, it is the Po will be disturbed. Okay, Po. And the heart, there will it is the spiritual energy of the heart is the Shen. Okay, Shen will be disturbed. Sadness and grief cause to deplete chi and can cause to chi deficiency or feeling chi feeling to move in the chest. Okay, okay. So in chest it cannot move. Prolonged sadness can involve heart blood, that is Shane, and sometimes kidney, that is the tears and the deep grief. Now, let us discuss the common TCM patterns, which with the acupuncture protocol. Okay, what are the TCM patterns of the sadness and the grief, and what are the acupuncture protocol we can use for managing the sadness and the grief? So for each pattern, first you have to maintain clinical symptoms. There is the main clinical symptoms. Then it is the primary treatment strategy. Primary treatment strategy. Then points prescription. That is the main point first. Then the additional points are after. So let's discuss briefly. So how to manage, how to identify the pattern, how to differentiate the pattern, and how to make the accurate protocol as per the patient's symptoms. Every sadness and grief patient is the unique. You cannot use the standard protocol for every patient. You have to identify the emotions, why sadness and griefs come there. There are the many reasons. You have to identify, you have to take the history of the patient. So, pattern number one, lung chi deficiency. That up. So, when lung will be deficient after prolonged grief, grip will be chronic grip, prolonged grip. So symptoms are the low energy, weak voice, shortness of the breath. Okay, in prolonged, understand, you can write down lung qi deficiency after prolonged grip. Okay, so symptoms are the low energy, weak voice, shortness of the breath on exertion, not inhalation. When patient exhale, he cannot exhale fully that air from the chest. Then spontaneous sweating. Spontaneous, always patients have the sweat because pore of the skin are widely open because of lung qi deficiency. If you see the patient tongue will be pale and pulse will be weak. So what is the emotions of the patient when there is the lung qi deficiency, when there will be prolonged grip. So that emotion level is the low mood. Patient have the low mood. And is he crying? If patients you talk something hard, patient will be start to cry. And patient don't have the motivation, lack of motivation. Now, what is the pattern? What is the treatment strategy? So tonify and raise lung qi. So we have to tonify and raise lung qi in case of lung deficiency after prolonged grip or after prolonged grip. Our strategy should be tonify and raise lung qi, support wei qi. Okay, defensive qi. We have to support defensive qi when the skin pores are open. Okay, so exogenous factors will be enter in the body. Okay, so there will be the disease condition easily. He can uh, suffer with the any cough and cold. Open the chest. So open the chest so chi can move. These are the strategy. Tonify, raise the lung chi, support wei chi, open the chest so chi can move. Now points are, first point, it is the LU9. Okay, LU9 locations. I am showing the LU9 location. Because I know most of the people are new to acupuncture. So you have to know the perfect location of each point. LU9. Tai Yuan. So it's the Chinese name of the LU9 is the Tai Yuan. So this is the shoestring point. It is the Johnson's point. Shoestring and Johnson's point. This is the tonification point, and this is the earth point of the lung meridian. And this is the infiltration point for the vessels. Vessels. This is the influence point for the vascular system, LU9. This is the influence point for the vascular system. So location, outer end of the wrist crease on the lateral side of the radial arteries. Okay, so I'm going to zoom this picture so you can see this outer end of the wrist crease. Okay, lateral end of the wrist crease. Okay, this is the LU9. Okay, this is the this point 25 long. This is the source point. This is the 25 application point. Our next point is the LU7 here. Okay, I don't need to open next image. So this is the LU7 in the red color. You can see LU7. Okay, this point regulate lung, release the exteriors and open the chest. It is always used for the grip. When there is the grip, always use LU7. Then our next point is the ST36. Okay, this is the ST36. Okay, location is on the one finger breadth lateral to the anterior end of the tibial tuberosity and the 3 below the knee crease, lower border of the patella. Okay, palpate the lower border of the patella. Okay, knee bone. Okay, and count your forefinger down and one finger lateral from the tibia, tibial tuberosity. ST36. See this point. ST36. Okay, this is the ST35. It is the lower border on the uh, uh, patella bone. And count the forefinger. Forefinger means 3 chun. And one finger breadth lateral from this tibia bone. Okay, very easy to locate. Then our next point is the range 17. Range 17. This ST36 can the boost chi. This is the water and granary point. Water and the granary point. So it's this point boost chi. So one story I'm going to tell you about the ST36. Okay, if you want to go into marriage in the afternoon, okay? So and they said you have to eat the lunch in the marriage. Okay, both of your close patient, close relative, and how to do this? Okay, you go to one marriage and eat the lunch, and before going to second marriage, give moxa to ST36 on both sides for 10 minutes. So immediate you will be feel hunger and you will take lunch there. Okay, so your both relative will be satisfied. So this is the story of the ST36. So ST36 have the treat thousands of disease. ST36 treat thousands of disease. Okay. Then we are moving to our other point, RAN 17. RAN 17, this is a very important point for the chief. It's the behind the RAN 17, it is a that that is a pectoral chi is gathered. Okay. Okay. So houses pectoral chi. RAN 17, it is the C of chi. This point. This is the front move point of the lung. And this point open chest. Okay. This point open chest. Then bladder 17. Bladder 17. See the bladder 17. Urinary bladder 17. Sorry, urinary bladder 13. Urinary bladder 13. This is the back shoe point of the lung. Urinary bladder 13. It is the back shoe point of the lung. Okay. How to locate? 1.53 Kun. 1.5 June lateral to the lower border of the spinous process of the third thoracic vertebrae. Okay. You count thoracic, thoracic 1, thoracic 2, and thoracic 3. Okay. It is the 1.5 June lateral to the lower border of the spinous process of the third thoracic vertebrae. Okay. So this is the bladder 13 point. You can see. Okay. Thoracic 1, thoracic 2, and thoracic 3. This is the thoracic 3. And this is the spinous, this is a spinous process. You can see here. And it is the 1.5 June lateral from the this midline. This is the bladder 13. So how to use this point? Techniques are tonifying needle. So you have to tonify needle on lung 9 and ST36. LU9 and ST36 you have to tonify. And you have to slowly, gently tonify points on the LU7 and the bladder 13. And you have to consider moxa on the LU9 and ST36. When if young deficiency and patient have the poor constitution. Young deficiency, patient have the young, how to identify the young deficiency? Okay, tongue is the pale, okay, his complexion is the pale, okay, patient get tiredness, patient get fatigue. It is the symptoms are the young deficiency and patient have the poor constitution. Secondly, second pattern, it is the lung chi stagnation. That is the chest chi, that is the pectoral chi. Pectoral chi stagnation with the unnatural emotion. So it's symptoms of the sensation of the oppression and tightness in the chest. Sensation of the tightness in the chest. Exhale noisily. When patient exhale, there will be noise. So this like noise that patient create while exhaling. So patient have the low mood. Okay. So if you ask patient, so come with me. So patient will tell, okay, oh no, I have no energy to come with you. So I no energy to walk. Okay, patient have the low mood. So patient have the irritability, always irritating nature. Okay, and sometime there will be palpitation and tongue will be normal or slightly red side on the liver or gallbladder side. Okay, so pulse will be wiry or tight in the lung region, in the chest region. So what are the treatment principle? Treatment principle how to move chest chin. Okay, so there is the operation and the tightness. So we have to move chest chin. So and we have to relax the chest, and we have to smooth emotions and lung and the heart connection. Okay, lung and heart connection. We should being free. So points are again REN 17. So REN 17 open the chest and the front viewpoint of the lung. Then pericardium 6. Pericardium 6. Okay. So this point connect the chest to chest and heart. Connect chest to the heart and move the chest chi. Move the pectoral chi, so which is the stagnant. Okay. And calm the shin. Pericardium is responsible for the calming the shin. Then second point is the LU7. LU7. Okay. This point open chest and encourage the descending of the lung chi. Then other point is the stomach 40. This if flame symptoms, this is the very empirical point for the visible flame. Which there are the flame. One is the visible flame, and secondly is the non-visible flame. So in case of visible flame, ST40 work better. Sedate. You have to sedate this ST40. Liver 3 or GB34, either liver 3 or GB34. If liver involvement is there, okay, you can identify with patient tongue. So how to manipulate that point? How? So what is the technique? So even or the gentle sedation on pericardium 6 and LU7. Pericardium 6 and LU7, you have to sedate or gentle sedation or apply even method. Okay, you cannot apply even method, perpendicular needle. Okay, so we have to sedate the LU7. We can use perpendicular on the pericardium 6. So that because of local chest expansion with the range 17 and needle shallow manipulate with the relief operation. You also seated this point, against meridian flow. Okay, needle and shallow. Okay, that horizontally. Okay, so you can use this technique. Thirdly, third pattern is the heart chi deficiency. Third pattern is the heart chi deficiency. So it is the sadness causing to reduce Shen energy. Okay, when sadness is there, Shen will be depleted. Symptoms are fatigue. There will be fatigueness. There will be palpitations. There will be shortness of the breath on exertion. There will be anxiety and tendency to worry or cry easily. Okay, so patient have the tendency to worry or cry easily. Very simple reason, any simple reason, patient will be start to cry. Patient may have the poor memory. Patient have the pale tongue. How to identify pale tongue and weak pulse? So, what are the shame sign, spirit sign? So, reduced mental sharpness. There will be not a fine sharpness in that patient. Reduced mental sharpness and insomnia. He don't have the enough sleep easily. Okay, insomnia. So strategy. So we have to treatment principle. You apply the treatment principle. Tonify heart chi. We have to tonify heart chi, calm Shen, and support blood if needed. Okay, if there is the blood deficiency, we have to support the blood. Okay, so which points can be used? First protocol is the first combination is the heart 5 and heart 7. It is the Shen. So this combination, so these are the main points to calm the Shen. Okay, heart 7 is the main point is the calm the Shen. Second, pericardium 6. This point calm the chest. Okay, this is the distal point for the chest. Pericardium. There are the 6 distal points. We will discuss afterward. There are the 6 distal point in the acupuncture. Okay, LU7, pericardium 6, and LI4. Then UB40, ST36, and SP6. They are the 6 distal point in the TCM. So we are using the pericardium 6, the distal point for the chest. It's calm the chest and the shape. The next point is the range 17. Range 17, middle of in between two nipples. Okay, this point open the chest. Then point is the bladder 15. It is the backshoe point of the heart. Bladder 15. Backshoe point of the heart. Then last point is the ST36, stomach 36. We have to support the chi. Okay, this is the water and the granary point. And if blood deficiency signs is present, okay, blood deficiency, okay, you can check the patient reports. Am I audible? Am I audible? Please reply. मेरा आवाज सही आ रहा है? Okay, okay. So if blood deficiency sign is present, so we can use the bladder 17. This is the inflation point for the bladder. And spleen 6, it is the connector point. It is this is the one of the distal point, and also this point connect the three in meridian: liver, liver, kidney, and liver, kidney, and spleen. Okay, so this point is the connector point of it. Is the in case of indeficiency, we use the this point. And bladder 20, this is the backshoe point of the spleen. Bladder 20. So how to apply, how to manipulate this point? We are when we discuss. Okay, so tonify heart 7. We have to tonify heart 7 and bladder 15, and pericardium on the U1 method. U1 method means 90-degree perpendicular needle, and use heart 7 for calming Shen. So you have to reduce, we have to sedate this point. Heart 7, calming Shen. So TCM mentioned heart 7 is the main point for the Shen related, that memory and emotional work. Pattern number 4, heart blood deficiency. That is the chronic grief draining blood. When heart blood, so heart have the two patterns: heart blood deficiency and heart chi deficiency. When blood is deficient, chi also deficient, because blood and chi it travel together. Okay, so heart blood deficiency, that is the chronic, because of chronic grief draining the blood. That is the disturbed Shen. Okay, Shen is reside in the heart. Symptoms are palpitations, poor memory, insomnia, dream disturbed sleep, anxiety, pallor, okay, and scanty menses. Menses will be scanty, if applicable. And nail will be brittle nail. Okay, brittle nail is also sign of the liver blood deficiency. Okay, if the liver blood deficiency, then heart blood deficiency also there. Okay, because liver is the mother and heart is the son. Okay, there will be brittle nail, and tongue will be pale, because there is the no blood reaching to the tongue. Tongue will be pale and thin, and pulse will be wiry, thin, and weak. So strategy. So what is the strategy? So we have to treatment principles. We have to apply the treatment principle, nourish the blood, tonify heart blood, and settle Shen. We have to, so Shen is disturbed. So we have to settle down the Shen. So points are, we are taking again heart 15, backshoe point of the heart. Okay, heart 7, Shenmen point, pericardium 6, this is the distal point for the chest, and the bladder 17, this is the inflation point for the blood. Also, spleen 6, ST36, and the REN 4. Okay, so how to manipulate this acupuncture points. So tonifying method on the for blood. So nourishing point is the bladder 70, inflation point for the blood. SP6, it is the distal point of the lower geo. Okay, distal point of for the lower geo, and the stomach 36 is the water and granary point. Okay, you have to tonify these 3 points. Then gentle tonification on the heart 7 to calm the shame. Okay, there's a, because of this calming the shame. Okay, we says it is the Shen. Then number 5, pattern number 5 is the flame misting the mind. Flame misting the mind. Okay, so it is a flame misting the mind. Okay, so visible flame and invisible flame. Okay, invisible flame always the misting the mind. So flame plus and fire affecting the shame when sadness become stuck and turns into obstructive patterns. Symptoms are confusion, poor concentration, heavy headed, and mental cloudness. So, mental cloudness will be there. Possible flame sign, that is the thick sputum, okay, then chest fullness, and insomnia with the dreaming. So, that is the invisible flame. So, tongue will be sticky or swollen because damp and flame. Okay, in case of the dampness on or flame, tongue will be thick and sticky or swollen. And if you see the pulse is slippery or the wiry. And strategy, how to manipulate point. Okay, so manipulate, how to uh, uh, pattern. This is pattern. Okay, so transform the flame. You have to transform the flame. Open the orifice. Okay, you have to open the orifice and calm the mind and clear heat if present. So points example formula ST40, we have, this is the main point for the visible flame, ST40. And pericardium 8 and pericardium 5, these two combination for the invisible flame. If flame heat disturb the chain, flame and heat disturb the body. Okay, PC8 is the fire point of the pericardium meridian, and PC5. Okay, so this PC5, pericardium 8 and pericardium 5, these are this combination for the invisible flame, if flame and heat disturbing the shape. Other combination, DU26, DU24, and bladder 13. Okay, this combination open the mind and heart 7 to calm the shame, and rain 12, okay, it is the fortune up from the navel. So this point to treat epigastrium and flame source. Okay, this is the source point, source of the flame. Stomach is the source of the flame. Bladder 20. Also, you have to apply the bladder 20, the Baccio point of the flame. So how you manipulate, how you treat technique, how to needling technique. So okay, even method or the reducing on the flame resolving point ST40 and combined with the calming the heart 7 and the pericardium 6. So these 3 points you should reduce. For flame and heat, use pericardium 8 and Li11 as needed. Li11, it is a homeostatic point. Okay, so and pericardium 8. Okay, you have to sedate these 2 points. Also, you have to sedate the pericardium 5. So number 6, it is the heart and the lung combined pattern. Okay, this is the last pattern. So heart and the lung combined pattern. So after prolonged grip, after prolonged grip. So this is the mixed deficiency and stagnation. Symptoms are there are the mixed sign. There will be breathlessness, there will be chest oppressions and palpitations, low mood, poor sleep, tearfulness, sign of the both chi deficiency and the stagnation, and how to apply the treatment principle. Simultaneously support the deficiency and move the stagnant chi and calm the shen. Points are to be used combine tonifier and the mover. Okay, you have to use tonifier point and you have to use mover point. Okay, heart 7, pericardium 6, LU9, LU7, rail 17, ST36. Okay, bladder 15, bladder 13. So adapt stress to dominant symptoms. Dominant symptoms. You have to adapt stress to dominant symptoms. Okay, and practical clinical advice. Okay, what is the practical clinical advice? Okay, choose treatment according to the pattern, so not the emotion. So don't see emotion. What are the pattern you are looking? Choose your point, choose your treatment according to the patterns, not the emotion level. It can all deficiency. When there is a grip, there will be deficiency, especially lung chi, heart blood, or stagnation of the flame, and so you can treat accordingly like that. Then heart 7, PCM test. Heart 7 is the classical single most useful point for the calming the shen and is recommended for memory shen work. Okay, bladder 15, an important Baccio point for the heart for emotional symptoms. LU7 and LU9 are main lung points for the grief and the sadness. Remember this. Okay, I'm going to share the PPT with you in my group. Okay, so use this as your primary anchors. Then supportive therapy. Okay, we can use the supportive therapy. So moxa for chi deficiency. If there is a chi deficiency, okay, grief is there, grief and sadness is there. Okay, definitely there is the chi deficiency. Use moxa and auricular therapy. You can allocate So you use the Shenmen point on the triangular fossa. Okay, that is okay. Then gentle Kriya Yoga breathing. Okay, there is the fourth step of the Kriya Yoga. If you are interested, I will teach you. Okay, so you have to stay with me in full day. Okay, there are the four steps. Okay, basic to advanced. Okay, so Kriya Yoga breathing you have to do. So you have to do exercise, then psychotherapy. That you a referral when severe depression. Okay, when there is the severe depression, so exercise and the psychotherapy. Okay, so TCM emphasize combination constitutional tonification. One is the ST36, SP6, and the RAN4, which local chest and the heart point. Okay, this work for the chronic case. Now, let us discuss the quick sample example. So, example you can adopt. So, number one, if there is the acute grief with the chest operation, there is a shining, it's the because of chi stagnation. So use RAIN 17, pericardium 6, then LU9 and liver 3. Gently needling that and encourage to patient to diaphragmic breathing. Okay, so in Kriya Yoga, so I teach how to breathe the diaphragmatic breathing. Okay, so while needles are pricked in the body. Okay. Now, secondly, chronic low mood. When patient have the low mood and patient have the fatigue and poor sleep, that is the heart and the lung deficiency. This is because of heart and the lung deficiency. And in case of this, use heart 7, bladder 15, LU9, and HT36, RAN 4, and MOXA on the HT36 and the LU9 if patient is the cold and low energy. Okay, when low energy or the chi deficiency, blood deficiency, so patient extremities will be feel cold. Number three, mental cloudness and the poor concentration and the thick flame after prolonged sadness. Okay, flame will be thick after prolonged sadness. So use ST40, RAIN 12, Heart 7, DU24, Bladder 20, and Pericardium 6. Again, I am repeating ST40, RAIN 12, Heart 7, DU24, Bladder 20, and Pericardium 6. Okay, now you have to use safety and there is a red flag. What is that? If a patient have severe depressive symptoms, if patient have the severe depressive symptoms, so and suicidal ideation and psychosis or is unable to function. So advice its relative urgent referral to the mental health service in along with the addition to the TCM care. Friends, acupuncture is the supportive but not a substitute for the emergency case. In case of this severe depression, severe sadness, severe suicide thoughts. Okay, so clinical best practice. So you have to be a wise. Okay, clinical best practice. TCM discuss limit of the acupuncture alone for severe psychiatric disorder. If there is a severe psychiatric disorder, you should take the help of the supportive medicine. Okay, sadness. So summary is the sadness affect the lung and the heart. On lung and heart chi stagnation and the chi deficiency. So a recommendation for the heart 7, bladder 15, and the lung points appear in his this clinical constitution. Okay, so practical points function references is the LU7 for grief. LU7, this is the summary. Yeah, you should remember LU7 for the grief, ST40 for the flame, heart 7 for the shame, and bladder 15 for the heart emotional symptoms. And also supported by the TCM materials and the clinical acupuncture reference. Okay, so I am open for the queries. I allow you to unmute yourself. Hello, Shams. Shams, are you there? Shams, are you there? Shams, unmute yourself. I allowed you to unmute yourself. Dr. Shailesh.
Hello.
हाँ बोलो. कोकिला.
Namaste, sir. Namaste, sir. Thank you so much for a wonderful
हाँ,
session. Sir, this lung is getting obstructed by flame heat. Then what is the treatment, sir, to be given?
when there is a flame, so
Ah,
it is the ST40. You have to sedate the ST40. ST40. So I discussed all the protocol in this
ah,
session.
okay.
ST40. When there is a
Hmm.
visible flame, or like
Uh-huh.
cough, okay, like the nasal discharge. Okay, so it is a
Okay.
visible flame. Okay,
Okay.
so when there is a visible flame, you have to treat the stomach 40. It is a very empirical point for the flame.
So, invisible flame stomach 40. Visible flame, which point, sir?
Invisible, no, it is the visible points, visible for visible flame, it is the ST40. If invisible flame is there, so there is the pericardium 5.
Okay.
Invisible, there is a disturbed sleep, there is a mental cloudness, okay, unnatural behaviors.
So then you wouldn't treat, say, LU7 for nasal discharge, clear nasal discharge. Will you treat LU7?
No, nasal LU7 for the grief. we are treating LU7 for the grip. Okay, so you can use the LU7 for neck stiffness also, but that is for the flame, that is for the pain. But if there is the grief and the sadness, okay, LU7 specially treat points for the treating the grief.
Okay, sir. Thank you.
Okay, okay. Anyone? Shams, are you there? Unmute yourself. Shams. Okay. So thank you very much. Enough for today. Ending the session.
Thank you, sir.
Okay. Thank you. Thank you, Sumita ji.
Thank you so much, sir.
Thank you,
Thank you.
Indra ji.